Okay, so yeah, going on to that step, this toolkit's come around because there's been a lot of changes with the BFHI, BFI, and very specific related to the step 2 part of this. So I know we've got, if we go through the documents, there's been a lot of changes related to the number of hours of education. Yet I do know that still in the WHO documents, they do discuss a 22-hour type of training. But I'm also aware that there's many countries around the world that are getting very specific onto, okay, we've got to focus just sometimes on the competencies and a much shorter education. So I'm aware we now have what we call the importance of knowledge, skills, and attitude, which I think is essential in what's going forward with this. I also know there's seeming to be a lot of confusion in different countries of, oh, well, how do I do this? How do we use this toolkit? How do we get to, like, what hours do we need? What do we do? How do we evaluate? How do we do all of these things? And so I think we all know that you need a really good, solid basis of knowledge, because if you don't have the knowledge and you can't put into practice, what you're doing. Yet we all learn in different ways, and I also think that attitude is probably even a more important key, because that's how the message gets passed, and that's how parents, families, mothers feel like empowered, because it's how that person speaks to you. So the development of this toolkit is really, really important. And I know you've been part of this. So how would you like to share with us how to integrate this toolkit or information about the toolkit for us?
Maybe I should come back a little and say, yes, step 2 is only one of the changes that really in the new guidance, but it's a major one. Yeah. And most of the countries and people did not realize how huge this change is. Mm-hmm. It's really a paradigm shift, because before, as a lead assessor, I was going line by line, all the staff there, and say 20 hours. Oh, mm-hmm. Not 20 hours. I have to interview this person. 20 hours. Not looking at how is this 20 hours in the person itself. Is it just about the knowledge level? And research has shown, when they did the literature review at WHO, that really you need the skill and the attitude, because just the knowledge doesn't work. So the 20-hour efforts that were given in many countries didn't work. It didn't work out. So the shift is now, of course we need this, but what WHO and UNICEF would like is to have it at the pre-service level. Mm-hmm. If we have everybody with the same knowledge there, I have it all, the 64 performance indicators in the toolkit at the knowledge level. Everybody should have it. And then when you come to hospital to work, according to what you're supposed to do, where you work, prenatal, perinatal, postnatal, all of it, then you're supposed to have skills and attitudes, because you will be closer to the dyad. So that shift means that instead of focusing on, I have to give 22 hours, you don't have to give 22 hours. If you have a new employee, you have to check their competencies. And for this, you have the multiple choice questions to start with, because like you said, if they don't have the knowledge, then they won't be able to have the skills and attitude, maybe the attitudes, but all together you need. So that paradigm shift is not well understood yet. In some countries, they just said, oh, okay, this is what we have to integrate into our teaching. Yes, it could be. In the places where you don't have any training, then the 20-hour, of course, is there. So, but most of the time, by my experience, you come to hospital, this nurse has 20 years of experience. She worked elsewhere before. Did she learn something? Of course she did. What did she learn? Is it okay with the toolkit, the performance indicators, the competencies we're expecting? If it is, why in the world would I send her to a 20-hour course? Instead, focus on what she would need to better in her knowledge, in her skills, in her attitudes. And this is the basis for the step 2, the change. So since WHA, like the World Health Assembly, pushed on WHO, say you need the tools, well, 5 fools of us volunteered at the 5 orgs to develop a toolkit, tools. It was not a toolkit to start with. It was a tool to verify the competencies at the clinical level. Any type of competencies, whatever the healthcare professional working with a dyad. So it ended up being a toolkit. But it was a long process. We really didn't realize it. We were involving ourselves. So the 5 of us just volunteered. We barely knew each other besides working, in the 5 wards, but we were surprised ourselves to see how complementary we were, because our experiences are different, our professional backgrounds are different. We come from different continents, different cultures, different language. So it made a toolkit that was already almost international before we submitted it to experts. So it was really, and it's still, because we're still working into other tools to help the implementation. So this is how it got there. So what it meant for us was really to take in the guidance, the list of competencies that were there for step 2. And then we first realized that this doesn't apply to hospital. Don't forget, step 2 at the WHO is strictly for hospital. Like in Quebec and Canada and other countries, we have BFHI for community health settings, professionally working there. But WHO, the guidance is for hospital. So when we looked, there were competencies that did not belong there. I don't need to know what to do with mastitis when the mother stays at the hospital for 2 days. Hopefully she won't have a mastitis in 2 days. Okay, so things like that. Nothing about exclusivity of breastfeeding in the competencies. And then they were so vague, most of them, that you could fit anything in there. So the first thing we had to do is really refine the competencies and decide on what is a hospital competency that you need to know as a healthcare professional. Then we had to, well, first we had to define what is the competencies in healthcare, okay? And then redefine the competencies. And then how in the world do you assess this? Do you verify this at the clinical level? Because the idea is not with the pre-service or in-service education, it's more about verifying competencies. So we developed competence for each competencies. It was performance indicator, things that you have it or you don't have it, things I can see when I look at you. And then we had to clarify very clearly what's the difference between training and competency verification. So at that point, when we had developed this first tool, we sent it to experts. Since we were in the 5 orgs, I mean, experts were easily available. So we had 20 experts from 17 countries and 6 international organizations review this while we were working with the other tools, because we had to develop the multiple choice question, the case studies, and the observation tools. And we also did examiners resource, how in the world the countries will be able to choose and train the examiners for this verification of competency. So for us, it was a little bit more than what we thought we would be involved in. So, and we're still working on it, because the toolkit can be quite overwhelming, because it's huge, it's big. It was designed at first for verifying competencies at the clinical level. So it could be used in hospital like this, like on a unit, with a group of healthcare professionals, but it could be adapted easily for non-hospital settings with healthcare professional also. But then when the experts came back, they said, you know what, that would be interesting if you would also take those 64 performance indicators and present them as in the domains, in the perinatal domains, because this is how most of us teach at the university level in all the countries. So it's the same. That's why toolkit is big, because it's the same 64 performance indicator that are organized either by 10 steps, or they're organized by 7 perinatal domain, which are like prenatal, perinatal, and So, and then the multiple choice questions are the same, the case studies are the same, observation tools are the same, because they are linked with the performance indicator. It's just the same number, but organized differently. So maybe it's big, but I take either one. If I'm teaching, for example, in pre-service, I will take the domain. It could be easier. But if I'm teaching within the 10 steps within the BFHI program, then it's clearer in my head if I present with the 10 steps.
So that's a really amazing way of organizing it. I know, when we've looked at it, it does make it, in my mind, it does make it much easier looking at it from the domain perspective.
Because you're an educator.
Yeah, because
but I'm a lead assessor. I will tell you, like the 10 steps just are quick like this for me. So either one.
So how, like if you were looking at speaking to a facilitator who is been just said, okay, we're going towards the baby-friendly process. We've done it previously like this. What would be an easy step or an easy guideline for them, for that person to say, okay, I've got this toolkit now. Okay, I know I have to get my education sorted. I'm just trying to think, what would be an easy or a really nice thing to be able to share with the educators of an easy way to integrate this new toolkit into their practice as they're continuing on their journey of BFI or BFHI.
Okay, so you're talking about facilitator, facilitator and educators. For me, it's two different things.
So facilitators in the hospitals. Yeah.
Let's say I'm a head nurse or a clinical director in perinatal. Okay, so I'm responsible for care and services on my unit or units. It depends if you are having like domains like delivery room, and then if you have C-section done there or in the OR, and then you have maternity, and then you have neonatal, and then it depends in your country. So let's say I'm responsible for that at the clinical level. I need to know if my people are performing according to those indicators that we have. Do they have the competencies? We presented that to the BFHI network into webinars. Like we were explaining, for example, if I want to try, I could try the whole thing, say, okay, let's go and have everybody do all the questions at the knowledge level. And then I'll be able to identify where are the gaps. And then I could organize for my team or parts of my teams, depending, this type of continuing education instead of everybody goes for 20 hours. So that could be like this. It could be that there's a group of physicians, who are coming like with new residents and all this. Okay, I decide I want to know how they are. And then what I want to give them as training as a group. So let's go to have the questions. Once you have all your questions, you identify the gap. And then as a group, you can have it. You can do it for one new person. Okay. I would tell you here in Quebec in May, most of the graduates come and they are brand new. So they may have the knowledge, they may not have it. What I would do would be part of that orientation they have to the hospital, have all those questions there. So I will know then when they go to the unit, say, this group is poorer in this area. It's stronger in this area. So let's focus on this. It could be with quality circle. I want, like, the BFHI has been implemented, but we always need to upgrade and upgrade and upgrade. So I want to test, is my people still up to date with our competencies? So, okay, let's go with the knowledge. And then if it works, then you can go to case study together in circle. And it could be by, for example, I want to know about step 4. So I will look at the knowledge just for step 4. And then I will go with case study discussion in step 4, either multidisciplinary or discipline by discipline. It depends on your context. And then observation, audits. You got the tools there. So you go and check as a group, how are they performing? What are they doing? What can I better in my own team? So it's really a quality of care tool. So BFHI is, so the toolkit is just along with this.
Okay, that's brilliant. Any key messages for hospitals that are heading towards baby-friendly certification in the up and coming years?
I guess the same thing I just said. I would use the new tools to know where my people are, and just to try to prepare them, for the assessment or reassessment. And at the same time, not only focusing on BFHI certification, but what kind of service am I offering to dyads coming in my hospital? And be proud of what I'm offering, but even prouder if I know that, because this toolkit, those competencies are the basics. It's basic. What if my team has all this basic? Well, hell, I'll go higher and higher and give them more. Because why are we there? We're there for the dyads that, they come to the hospital, and for one of the most important time of their lives, giving birth is something you remember all your life. Of course. You have the kids to remember also, because they are there. But I mean, it's just this toolkit is a tool really to help us better the type of care and services we can offer.
So we're challenging our basis of care based on best practice, good evidence, and ensuring that we've got a quality care that's provided to all the dyads.
And I would say, the toolkit identified the basics. If as a healthcare professional, I know that this is what I'm supposed to know and show and demonstrate, I cannot say I don't know, because it's there now. So if a whole team wants to be up to date with what they offer as professional service, they cannot say, well, we don't know really what's expected. We know. Internationally speaking, this is what is expected. That's the basics. You can go further. Hopefully you'll go further. But at least this is the basics for all healthcare professionals.
Thank you so much, Louise. As always, I love chatting with you. We have a great time. You make a difference in the fact that this is best practice, and I think everybody's goal is simply to make sure that the families, the dyads, get the best care possible. And as health professionals, we have a responsibility to make a difference there. So again, thank you so much.
You're welcome.
Have a great day. Thank you.
Okay, bye-bye.